Hello, my name is Cassandra Duff. I will be presenting on behalf of Group 15, including members Bailey Duncan and Adrian Larry. This presentation is for the Professional Role Development course through Arkansas State University. The topic of discussion will be the power of collaboration in advanced practice nursing. Before getting into the power of collaboration, we wanted to identify what collaboration isn't, as these often get confused with collaboration. So it is not parallel communication or functioning. This occurs when clinicians interact or care for a patient separately. They do not talk to each other before seeing the patient, however, they are addressing the same clinical problem. It is not a one-sided compromise. This occurs when a clinician is overly agreeable or yielding to another clinician's decisions. It is not an information exchange, which occurs when information is exchanged and there may or may not be a decision to be made. However, if there is, it is unilateral and there is no joint planning. It is not supervision. This occurs when a clinician delegates care to another. However, the supervising clinician retains the authority over the care. It is not a consultation. This occurs when a clinician seeks advice from another clinician, but the responsibility still remains with the initial clinician. It is not co-management. This is typically a result of a consultation where two or more clinicians are providing care, but they only retain responsibility and accountability for their aspect. It is not coordination. This occurs with one-sided communication to achieve a goal. It is not a referral, which occurs when care is directed to another clinician. And it is not faux collaboration. This occurs within a hierarchy. A person of authority thinks that they are being collaborative because everyone around them is agreeable, but there is no meaningful dialogue between the team. So what is collaboration? It's quite complex, but Tracy et al. Defines collaboration as a process by which nurses come together with patients and other healthcare members and form a team to solve patient care or health system problems, with members of the team respectfully sharing knowledge and resources. So the key elements of collaboration are that it is interactive, requiring two or more participants that form a team and respectfully share knowledge and resources. This is influenced by positive attitudes, and there needs to be a common purpose or a goal that the team is working together to meet. And now there are quite a few requirements in order to have successful collaboration. These include competence, accountability, common purpose, effective communication, role clarity, trust, mutual respect, recognition and valuing of diverse knowledge and skills, and humor. Over time, as clinicians work together, these requirements will develop and strengthen collaboration within a team. Now, there are many types of collaboration that can occur within a healthcare system. This includes multidisciplinary, interdisciplinary, and transdisciplinary, with the suffix disciplinary meaning fields of study. There's also interprofessional, for example, between physicians and nursing, and intraprofessional, which would be within the same profession. Now, with all of that in mind, what is the goal? Osman et al. Describes interprofessional collaboration between nurses and physicians as essential for improving patient outcomes, healthcare efficiency, and professional satisfaction. All right, so to go a little further in depth on the importance of collaboration in advanced practice nursing, we're going to highlight some of the things that we can achieve by utilizing it in practice. We can improve patient outcomes. So effective collaboration ensures a comprehensive assessment is completed, an accurate diagnosis is made, and an effective treatment plan is in place. We can ensure patient safety. Collaboration enhances communication among healthcare professionals, ensuring that all team members share the same common goal of a comprehensive treatment plan, noting any potential risks. We can reduce healthcare costs and practice fiscal responsibility. Through collaboration, redundant testing is eliminated among healthcare professionals. Resources are optimized and utilized to prevent hospital readmission, and preventative care is the primary focus in managing chronic disease. Successful collaboration requires clear and precise communication, which in turn minimizes errors and miscommunications. The multidisciplinary approach ensures that all aspects of the patient's health is considered, leading to more informed and safer decisions. We can enhance job satisfaction and promote professional growth. Collaboration fosters a positive team spirit, making all members of the healthcare team feel valued, heard, and supported. Collaboration also promotes open communication and transparency within the workplace. Healthcare team members feel they can openly share their ideas and receive feedback. All right, now we're going to go over some examples of collaboration. The first one is collaboration between a family nurse practitioner and an emergency department physician. A young adult presents to the urgent care with right lower abdominal pain, nausea, and intermittent fever. The family nurse practitioner does basic blood work, urinalysis, and a comprehensive physical exam. Because the urgent care does not have imaging, the FNP contacts the on-call ED physician. Through effective communication, the ED physician recommends that the patient be sent to the ED for further testing and imaging. Without appropriate collaboration, appendicitis could go undiagnosed. So in example 1, the FNP acknowledges that there is a lack of a resource, imaging. Through collaboration with the ED physician, they come together and create a plan with the goal of successful diagnosis and treatment for this patient. The collaboration between the FNP and the ED physician is an example of interprofessional collaboration. In example 2, we're caring for a patient with chronic diabetes. Family nurse practitioners must be able to efficiently collaborate with a case manager to assist with ensuring the patient is appropriately maintaining follow-up appointments and management of diabetes. The FNP must also be able to collaborate with the pharmacy and pharmacist to ensure that the patient is able to financially afford insulin or other medications to manage the diabetes. And the FNP may also need to collaborate with a nutritionist to help educate the patients on insulin and carbohydrate balance. In example 2, the FNP is on a team including the case manager, pharmacy, and nutritionist, all with the common goal of effectively managing a patient with chronic disease. Without successful collaboration, this patient could experience an adverse event. This is an example of multidisciplinary collaboration. Now, there are some barriers in collaboration. One of them is the physician hierarchy. Physicians are generally dominant in most healthcare settings, and nurse practitioners are often seen as assistants rather than a partner. There is the limited professional autonomy. Scope of practice regulations may restrict the extent to which an advanced practice nurse can practice, including assessment, diagnosis, and treatment plans. This can prevent nurse practitioners from fully contributing their skill level to the comprehensive plan of care. And then there's insufficient interprofessional training. The lack of educational opportunities and training for nurse practitioners and other healthcare professionals can result in miscommunication about roles, responsibilities, and capabilities. So, to accomplish effective collaboration, there should be role clarification and shared goals. Each member should know their part and what the goals are. Open communication and active listening. It's all about working together. Conflict resolution and feedback mechanisms. Members should be able to know when and how to give feedback and how to resolve any conflicts that would arise. Continuous quality improvement and reflection. What went well? What didn't go well? How can we do better? In order for collaboration to work and succeed, you have to be willing to do it. Another resource you may be familiar with is Team Steps, or Team Strategies and Tools to Enhance Performance and Patient Safety, which was developed by the U.S. Healthcare Research and Quality Agency. It's an evidence-based program that's utilized in healthcare, and these strategies and tools in the program are thought to improve collaboration and can be used in practice. Other strategies for successful collaboration include fostering a culture of trust and mutual respect, providing ongoing interprofessional education and simulations, defining measurable goals for collaborative outcomes, and gaining support from leadership and institutional commitment. This concludes our presentation on the power of collaboration in advanced practice nursing, and we hope you found this information valuable.